Hi everyone, I'm Dr. Roman Hunter, and today we're going to be talking about manual muscle testing, otherwise known as MMT. Now, MMT has 6 grades, from grades 5 to 0. Grade 5, otherwise known as normal, is when the person is able to complete full range, or in other words, throughout the available range of motion, and is able to hold against maximal resistance. The muscle is able to hold against maximal resistance. For grade 4, otherwise known as good, is when the person is able to complete the full range or the available range of motion and is able to hold against moderate resistance. So if you were to apply maximal resistance and the person breaks, that would be a grade 4, right? So it's just moderate resistance. For grade 3, otherwise known as poor, or fear rather, my apologies, is when the person is able to complete full range without manual resistance. So they're able to complete full range or go through the available range or go to any range just against gravity, in a gravity maximized position, all right? For grade 2, otherwise known as poor, is when the person is able to complete partial range. They're unable to complete the full range, just partial range, or you put them in a gravity minimized position and you're able to perform the full range in a gravity minimized position. All right? For grade 1, otherwise known as trace, is when the person just has a palpable contraction or a visible contraction. And for grade 0 is when there's no visible nor palpable contraction occurring in the muscle. And 0 is otherwise known as, you guessed it, 0. Alright, so when performing MMT, you want to make sure that the body part is exposed. You don't want to have it fully clothed or you have bulky clothing over the area that will limit the range of motion and you won't be able to see any visible muscle contraction occurring. So you want to make sure that the area is exposed and you drape them accordingly. Alright, now in terms of, just before we go, I just want to also mention that for some joints there may be some arthritic changes that will affect the range. So the person may not be able to perform full normal range of motion just because of arthritic changes occurring within the joint itself. May also be due to capsular issues or some internal derangements occurring in the joint. So you allow the person to take the limb through the available range that they have within their capacity, through the available range, or you take them to the end of their range. They're able to take themselves to the end of their range. And you perform the test within their available range that they have. Alright, so this is MMT, manual muscle testing, that we'll be talking about. Thank you very much. Today I have here with me Colin Ormsby, and we're going to be doing a manual muscle testing for shoulder external rotation. That's MMT for shoulder external rotation. Okay, so we have here the patient is in prone line, and this is the starting position for shoulder external rotation. It's also the starting position for internal rotation, but we'll be doing that in another video. For shoulder external rotation, patient is in prone line, lying on their stomach. You have a cushion or a towel roll that supports and stabilizes the shoulder, and the face or the head of the person is turned towards the testing arm. All right, the head of the patient is turned towards the testing arm. The position of the therapist or the examiner is standing at the level of the waist of the patient, facing the patient. Because as I've been saying from before, you know, especially for this position, for external rotation of the shoulder is a very compromising position for the shoulder joint. And for some persons, asking the person to externally rotate the shoulder produces some pain, depending on the situation. And especially for the elderly, this can be a somewhat discomforting movement for the shoulder, external rotation. So when facing the patient, you can have an idea in terms of if it is uncomfortable for them, because you're watching their facial expression. All right? Now, this hand, this will be the hand that will be providing the counter pressure. So the instruction that you'll be giving is go ahead and lift the back of your hand up towards the ceiling and stop at the level of the bed. Go ahead and lift up your hand, like you lift it up towards the ceiling, stop at the level of the bed. So this is the movement, and you want to make sure that the shoulder is 90 degrees of abduction, and you want to make sure that the elbow is 90 degrees flexion when performing the MMT for shoulder external rotation. All right, and the bed also supports the humerus or the arm of the patient. So you have the whole arm being supported by the surface of the bed. Now, the counter pressure will be added to the elbow, the inside of the elbow, and you're going to be using 2 or 3 fingers and apply the resistance distal forearm. 2 or 3 fingers to apply the resistance distal forearm. So again, you have one hand here to apply the counter pressure underneath the elbow or the inside of the elbow, and you're going to have 2 or 3 fingers applying the pressure distal forearm or just above the wrist. And the instruction that you're going to give is hold it, don't let me push it down, don't let me push it down, hold it, hold it, hold it. There you go. And that will be a grade 5 for shoulder external rotation. And of course, a grade 4 is when they break under maximal resistance. They break form under maximal resistance, or they're able to hold against moderate resistance. And you can go ahead and lower the hand again for me. For grade 3 is, go ahead and try and lift the hand up again. They're able to complete the available range against gravity only. Not against any manual resistance, but only against gravity. This will be a grade 3. And this is the MMT for shoulder external rotation from grades 5 to 3. Alright, great. Now for shoulder external rotation, for MMT shoulder external rotation grades 2 to 0, the person is still in prone line, as you can see here. However, the bed is no longer supporting the arm, as you can see. The whole entire limb that will be tested is hanging off the edge of the bed, right? The head of the patient is turned towards the testing limb. The hand or the arm is in a neutral position. As you can see, the thumb facing in and palm facing back. The position of the therapist is in a seated position, so it's easy to maneuver the arm, as I'll be showing you shortly, and still at the level of the waist. Where will you be palpating is, you will be palpating right where the teres minor is and the infraspinatus. You'll be palpating right there, right? Almost like by the axilla, the posterior axillary area. The posterior axillary area right there. So the instruction that you'll be telling the person, that you'll be telling the patient is, go ahead and turn the palm out, or you can say, rotate the thumb out for me. Go ahead and rotate the thumb out for me. And this will be a grade 2. They're able to fulfill and accomplish that movement in a gravity minimized position. So it is not against any maximal gravity, it's a very minimized position, and they're able to fulfill, achieve that movement. All right, go ahead and put the palm back inwards or turn the thumb back inwards. All right, stop right there. So that will be a grade 2. For a grade 1, of course, you ask the person to perform the same thing and you're unable to perform the movement. And for grade, but you still feel the contractile activity going on there where the teres minor and the infraspinatus muscles are, right? However, if there's no contractile activity occurring and there's no movement of the shoulder, then at that point it will be a grade 0. Okay? Now, there's an alternate position, what you can do for a grade 2 as well. If it is that the person has difficulty rotating the palm out, you can manually position the arm in external rotation. You can manually turn the thumb out, and then the instruction that you'll say, the instruction that you'll give the patient is hold it there, hold it, hold it, hold it, hold it. Don't let it rotate back in, hold it in that position, and you're able to hold it successfully in that external rotated position, and that will also be a grade 2. So that will be the alternative position for a grade 2. You manually rotate the shoulder in external rotation. Now, there are other alternative positions for grades 3 to 5, which I'll go through with you shortly. Alright, so the alternate position for shoulder external rotation for grades 4 to 5 or 5 to 4 is in a short-seated position like this. Short-seated position, alright? So the feet are hanging down. It can either be supported or unsupported by the floor, and the body upright. You want to make sure that the elbow is bent, is 90 degrees flexion of the elbow, and it is tucked into the side, alright? The forearm is in a neutral position with thumb facing up. The position of the therapist or the examiner is to the side of the limb that will be tested and also facing the patient. Right? Now, you're going to apply counter pressure. The counter pressure will be applied to the inside of the elbow. So one hand will be put on the inside of the elbow, the other hand will be applied distal forearm or just above the wrist. So distal forearm just above the wrist. So I'm going to put it here so you can see to the camera, and the other arm here. And I'm standing to the side and front of the patient. What I'm going to say, the instruction I'm going to give is, don't let me push it in, don't let me move the arm in, or don't let me push the palm of the hand in towards the stomach. Don't let me push it in, don't let me push the palm in, keep holding, don't let me move you, don't let me move you, okay, and that is it. And that will be a grade 5, and of course, a grade 4 is if the person breaks form under maximal resistance, and they are able to hold against moderate resistance. So this is the alternative position for MMT, shoulder external rotation for grades 4 to 5. Thank you.